Welcome back to another week of Podding with PT. I'm Tyler.
And I'm Patrick.
And this week we got Dr. Dusty Deads joining us all the way from Boston, Massachusetts. How you doing, Dusty?
You know, it's a little colder over here than what you guys are dealing with, but yeah. I'm doing good. It's good to see you guys because I haven't seen you guys in a long time.
And forever.
I know, but glad to have Dustin here on the pod. He has a great mind, just breaking things down to mechanics, physics. Definitely goes way into more detail that I ever think of. And he has some pretty interesting ways of treating and the thoughts on treating. So I'm glad to get a little deeper into that. But Dustin, can you just give us your background and just how you got to being a physical therapist and a strength coach?
Yeah, I guess we can just start, back to high school when I kind of started my quote unquote powerlifting career. We had a teacher who was also our lifting coach in high school who was a big influence on me. My first powerlifting competition was when I was a junior in high school, and that was before powerlifting even became like anything popular. I deadlifted 525 my junior year, 600 my senior year. It was pretty illegitimate, but like still picked 600 pounds up off the ground, locked it out at some point. But it was at that point where I was like, this is fun. I enjoyed it a lot. I went on to Springfield College for undergrad, where I majored in sports biology, minored in nutrition, played football for a year there, but realized I kind of just wasn't ready for the collegiate level. And I was also there primarily for academics. So I was like, this is going to take up so much of my time. I realized I also enjoyed the process of like strength training so much more than like playing a sport at the time. And that was kind of like where my passion lied. So I was like, let's just focus on school and lifting. And it was probably one of the best decisions I'd ever made, especially being at Springfield, because like everyone there is just a meathead. And it was like the perfect environment just to like thrive in that essence. And there's also a lot of great thinkers that to this day, like a lot of kids I went to school with are making a lot of moves in like the strength and conditioning field, PT field, etc. Springfield really kind of is everywhere, and I didn't really understand that until I had left it and went to Sacred Heart for grad school. I was like, yeah, the networking at Springfield is kind of like nuts. It's kind of the reason why I have my job I have now too, and I'm definitely grateful for it. How I got into PT, I didn't think I wanted to do PT until I was actually in PT school. I thought I wanted to go to med school, and I'm very, very glad that I didn't do well in the MCAT, because it definitely isn't the profession that I was meant to be in. I'm definitely where I'm meant to be now as a PT and also a remote strength coach. Yeah, PT is just the way I want to have an influence on people, connect with people. I feel like it's much more personal than some other medical professions. And I think the way I act as a clinician fits the bill of how I want to be a PT.
Gotcha. I think one of my questions also is kind of how Pat was talking, because a lot of the stuff I just think of the movement. And every time I see like your posts or even talk to you, you're like, if you put your foot at this angle, it does this force. I was like, what the fuck does that even mean? But so how did you get into that point?
I think a long time ago, I just found certain people that thought a certain way. I've just paid attention to them from afar. Like I have my internet idols, I guess you can call them, that like I've just listened to speak for so long. It kind of influences your way of thinking rather than just like giving you the black and white answers and being like, oh, like this exercise will do this. Instead, it's more like these individuals progress your way of thinking and thought processing and questioning to make you then question everything you do on a daily basis. So it's like, if you're going to the gym, every time you do an exercise, that's an opportunity to do a repetition and learn something, and try different things. I also think just like experimenting and feeling things yourself from a sensation standpoint is a big thing that'll benefit you as a clinician, and understanding how like physics works, how physics acts on the body, because we're all subjected to the same thing, and that's gravity. So it's like we're going to negotiate ourselves against gravity, typically in the same fashion, depending on our builds. Everyone's going to be kind of different because everyone's kind of built differently. So it's like center of mass. How are you standing upright against gravity? How do you negotiate yourself through different movements, I guess? But yeah, I kind of look at the way humans move as like we're always in some degree of rotation, kind of like a double helices. So it's like at every joint, at every moment, we are in some degree of rotation against gravity. And that's kind of where I then distill my thought process from when I look at an individual that comes in to me with like any sort of pain or etc.
So, excuse me. So when you look at if everything's based on rotation, is that when you're creating a plan of care, are you thinking anti-rotational movements or rotational movements are kind of like the basis for everything that you give them?
I think it depends, right? Typically, let's say if you have like an athletic individual who may be better at producing force, they also may be better than, like by default, better at resisting movements as opposed to creating them, or vice versa. It depends on what they're better at. Like if I have someone who's a power lifter, they're going to be really good at resisting force and resisting those deviations at the trunk. Whereas if I have a baseball player, they may be better at producing those degrees of rotation, and they need to fall on the other end of the spectrum where they need to be able to resist things better. But even just like very, very small changes can make a big difference. Like sometimes if I want to just get quick buy-in from somebody, a good example is this one girl we had in our clinic she was like a freshman softball player, kind of like upper mid thoracic pain. The PT was treating her was like a little stumped on it, asked me for help real quick. I looked at her and just from the back to see like, all right, are you biased towards one side more? Like any small degree of rotation. She was a little bit more biased towards rotating to her right because that's her throwing hand. Had her do like a modified push-up with her left hand offset, so elevated. So it just put her in a little bit more left side rotation. I think we retested for pain with just like seated rotation. And after a set of 8 of those push-ups, she didn't have the pain. So that then just leads you down the right direction of like, all right, she is good at this one thing, needs more of this other thing, that then gave us a positive test retest. But it can be even something as small as that. They don't need to be sitting there twirling around like a windmill or anything like that. It can be something that small where it's just a 3-inch block underneath their hand.
So I think my question with that then becomes, I've heard like mixed reviews on, say you have like someone that's a one direction type of thing, like a softball pitcher. She's a right-handed pitcher. She should be very good at throwing with her right hand, or like the muscle bulk on that side. Do you look to then train to even her out, or do you want to make her stay strong in that right hand and then maybe add like some neuro things like that? So maybe she might just needed like a neuro type of like left hand assist. That makes sense.
Right. I think, to be honest with you, I don't think I've ever really looked at like establishing like true like end goal asymmetry, but instead maybe like acute symmetry, not end goal asymmetry, end goal symmetry, but instead maybe establish it like in the acute sense, because in that short-term period that may open up a window, a pain-free window to then progress through, and then kind of let the athlete / individual fall into like whatever they're good at. So like at first, maybe you do need to have like a foundation where they're symmetrical, but then as you progress them down the line, they will probably fall back towards what they're good at, and allow them to be asymmetrical as long as it's not provocative at that point. You know what I mean?
Yeah.
Because like at the end of the day, to complete their task, they're going to have to be asymmetrical to some degree. And if you ask certain individuals in the PRI field, the world is inherently asymmetrical. But we won't get into that.
But I think that's an important thing to kind of touch on. So with the PRI thing, saying that you're asymmetrical, but the problem then becomes is, can you get over to that other side, or can you unwind that asymmetry at some point? I don't know. Is that something that you ever look for, to be like, okay, I want to make you strong and with your right hand and being asymmetrical, but I do want to see you have the strength or just the motor control to get out? Because then I started thinking of pelvic tilts and like sprinters. It was like, you kind of touched on how football players, it's not bad that they have an anterior tilt, but for me, I'm like, if you have it, I want to make sure that you can still control getting out of it.
Yeah, I think you just worded it pretty well too, compared to what I said. I would view that as kind of like the foundation. And to kind of piggyback off that, that's kind of how like I view movement. It's like essentially how I view anything. If you look at the way a person moves, you can kind of make it a bell curve. So like football player, for a good example, like let's take an offensive lineman. They're probably going to be very like extension biased. So they'll fall at one end of the bell curve in terms of extension, where at the other end of the curve is your flexion. It's like, yeah, you're really good at this. Let's have you work through the rest of that curve to then make you better here. And I've had to explain that to like even some high school kids. It's like, you're good at doing this one thing. If we can get you to be good at the rest of it, it's just going to supplement what you're really good at. So yeah, I think that's a good way of looking at it too. It's like, you are stuck here, let's say stuck. If we can get you to then tolerate being out of it, it's just going to make you better at the thing you're currently stuck at.
Gotcha. I like that.
Yeah, that's one thing I've been meaning to make an Instagram post for a long time, but it's like figuring out how to do it in a absorbable manner.
Right. How's I actually want to take a step back and talk about your feelings through physical therapy school. And because I know initially at first, we Dustin and I lived together, and we were pretty much struggling along, especially the first semester, just like trying to just wrap our heads around everything. So how was that experience for you, just like from the start of PT school and then trying to finding your groove and finding that you belong in this space?
Well, first off, yeah, I think the fact that we live together is pretty major for both of us, because I feel like sometimes we were in the same position and it was pretty beneficial for both of us. I say now that I hated school from like I'm not built for school, I guess I should say. Like I wanted to get out of it as much as I could, from being like a bad test taker, etc. But PT school definitely taught me how to self-reflect, and I do credit that a lot to the way our program was run at Sacred Heart. Self-reflection, being able to just like almost criticize yourself on a constant basis and be like, all right, these are my current flaws. How do I get around them to then solve the problem that's facing me? As you guys know, my one kind of claim to fame was that like between our second and third semester, 6 finals, I only passed 2 of them. And here I am. And then 1 failed board exam later too. Like for me, unfortunately, it feels like failure is my pusher to some degree, but we all end up where we're supposed to be at some point. But yeah, PT school is definitely an animal of its own, and you have to figure out what works best for you. And I think that was an issue for a lot of us, because like we try to adapt study habits from other people we see around us, and it's like a trial and error type of thing. Like us as a group, we found what worked best for us over time, where it was like we all studied individually for a bit and then openly quizzed ourselves in the rooms and stuff. We found out what worked best for us, and that was our way of adapting. And if we didn't adapt, then see ya.
Yeah.
Right. And I between I want to say second and third semester was our neuro and cardiac topics, and you were thinking more like sniff. You're really like deep on the deep end of like neuromuscular reeducation and like just how the brain works. And so, and for a while you were saying that that's probably the career path that you were leaning towards, but now you're back in the ortho setting. Kind of how did you work through that?
I loved the sniff setting at first, because I also think it was my first taste of being a PT during that first clinical rotation. If from a clinician standpoint now, being in a primarily ortho environment, I think a lot of what I do intervention wise is very neuro based. I'm very big on sensation. I'm very big on like giving people, I always say it's kind of like hiding the vegetables in the spaghetti sauce, because like people sometimes have no idea what I'm trying to create with exercises I give them. Like it may seem kind of simple to them at surface level, but to me seeing it, it's like I know exactly what I'm doing here, here, and here, because you're going to feel this, this, and that based on the position I'm putting you in. And you have no idea that all these cards are at play but it's a simple-ish task for you to accomplish and succeed from. One of my favorite cues that I've had a lot of success with is any sort of like knee pain with any level individual in a closed kinetic chain exercise, cueing for some sort of pronation at the foot. I tell them just accept the force and distribute the force through the ball of the foot. I haven't had it really not be successful in terms of like mitigating some knee pain, whether it be like stepping down from a step, doing a split squat, doing a lunge, doing a regular squat. And I think that's really tied back to giving the brain feedback from the one joint that is in contact with the surface we're interacting with. So it's like if our brain can now interpret what the foot is doing all the way down there, that joint that's falling more proximal to the foot is going to be more aware of what it's doing in space as well. And it's kind of just like a sensory feedback thing where it's like the body knows now where we are in space and it's not telling us stop going here. And that's how I've kind of been interpreting that type of pain that we can influence so quickly. It's kind of like the brain stop sign saying, I don't want to go to this point in space because I have no idea what we're doing here. And by providing some sort of like biomechanical sensory feedback elsewhere in the chain and be able to influence that pain immediately, like I think that's one of the coolest things. I've had the same success with kind of like elbow pain and like, let's say if someone's doing like a push-up, cueing just for more pressure through the thumb. Like the thumb is the big toe of the hand. I've had success in the same exact kind of context with upper extremity stuff just from cueing that. And all it is just being more attentive to like what you're doing at the end of that chain.
Damn, I like that a lot.
Yeah, I would say I think my approach is pretty neuro-based because the brain is pretty powerful. And if we can utilize that and give someone those little cues to carry with them as the tools in their toolbox, and more power to our patients.
I think that's a huge thing. And even treating everyone as a neuro patient, I think someone posted that one time, is like every ortho patient is a neuro patient because you need to understand the brain. And I don't think, for me, sometimes it gets frustrating because I try to tell patients, I'm like, make sure you feel this, or where do you feel that? And a lot of times they'll finish the rep and be like, I don't know, I didn't feel that anywhere. I'm like, you didn't feel a single muscle at all when you're doing this. I'm like, you're doing like, say, Palloff press. I was like, you can't feel your abs in the slightest. I'm like, no. Or I was like, think about squeezing your glutes. And it's like the disconnect is so crazy for a lot of people. And I think that's huge to be able to be like, hey, make the sensation change, or understand how your foot feels when you're walking each time, or how your hand feels when you do a push-up. I was like, that is just key in and of itself.
Yeah, it reminds me of, with my patients, I always like to start with just deep breathing, just like a diaphragmatic breath, and just being aware of what you feel in this moment. And so I never cue press through your big thumb or press through your thumb or add more pronation, but just like, I think it's similar along the lines of like, your body just needs to be aware of what it's doing.
Yeah.
At this moment.
It always goes back to that present moment, because I feel like everyone's so far of, I got to go pick my kids up, I got to go do this at work, let me just go into my PT session for 40 minutes and then I'll be done. And it was like, take that as a time to fully like use that as your meditation. It was like, use that as your chance to understand what your body's doing or feeling or trying to tell you.
Right.
Yeah. I had a recent eval who was a lot of fun because she came in, it was like a kind of like a trochanteric bursitis presentation. Really cool individual right off the bat. A little bit on the older side, but she was like, yeah, I can't go up and down stairs without it hurting. And I was like, what if I told you I have a trick up my sleeve that maybe it'll get you to take a step today without any pain? And she's like, you can try it, but, and it fell right back to that. I know it was a little bit of that pronation cue, but I had her step up the stairs, and all I had her change was the direction of which she was stepping. Because if you watch most individuals going up and down steps, they'll keep their legs very far out to the side as they're going into like a single limb stance, and that puts just a lot of pressure more so and like demand for stability at the hip. And if you cue them to just step more midline, it's kind of like a pogo stick. If you're bouncing on a pogo stick, you don't want the stick to be way outside of you. You want it right underneath you. The very first step she took with a more midline step, the pain went away, and she looked at me and she was like, "How the hell did you do that?" And I was like, "It's physics.
Gosh,
Like you're just, it's like you're just making it easier on your body. That's all it is. It's efficiency. It's being more aware of taking that step. And typically, if you have someone with like a lower extremity that's more painful too, they'll avoid putting it more midline, putting that stress on it because it is more force. But more force doesn't necessarily mean more harm in that case.
Question for you, because I found a lot, like the average person really lacks internal rotation. So do you think that has anything to do with someone more likely to step outside so they can avoid more of that internal rotation?
Yeah. I also think internal rotation is kind of like where the glutes lie, like the whole, like where the glutes and stability really live. I think if you can teach someone to get from, if it's appropriate, all the way from the foot up to the hip, pronation up to hip internal rotation, like it's probably going to benefit them some, like to some point, because you're just promoting greater structural and muscular stability throughout the whole thing. I think internal rotation is interesting because I've seen like the trend on like Instagram go from like, oh my God, it's the answer to everything. And now everyone's like shifting away and be like, it's not the answer to everything. It's like, well, yeah, no shit. It's, oh, can I swear on this? I don't know.
Yeah, it's cool, dog.
Go ahead. Be you.
It's like, yeah, no duh. Like, it's not going to be the end, like be all end all. Like, I think everyone always wants a black and white answer to everything when there literally will never be a black and white answer. And there's going to be a million different ways to get things to work, but people will forever love arguing on the internet.
Oh shit.
Especially about minute details like internal rotation degrees, etc. But
yeah, we were talking about this yesterday, and me and Cam, it was like, it's crazy because if I go back to every single test that I took in PT school, if I had the answer for it depends, that would probably be right. I was like, he asked me one question. He was like, oh yeah, you get hit on the side of the neck with a baseball. Which range of motion are you expecting to be limited? I was like, fucking all of them. You just got hit by a baseball. I was like, that could be everything.
It's a traumatic experience.
Yeah.
Your body is probably doesn't want to move.
So I'm like, and it's crazy when I think about like, oh, internal rotation is the thing that's going to fix your back pain. I was like, it might help, but it definitely won't hurt it. I feel like that's just like, it's part of it. It depends.
Yeah, I tell patients that the one thing I love about PT is like, compared to other health professions, it's like we can kind of throw shit at the wall and see what sticks repeatedly. And so a lot of like MDs kind of don't always have that freedom because it's a little bit more dire. It can be in some instances, but like we can kind of constantly just test, retest, and see what works and get creative with it. But yeah, it's gonna depend.
On the since we're here talking about hip internal rotation, you had an interesting take that the hip is the shoulder in reverse.
Yeah, this is like one of my driving thoughts. When I've gotten home some nights, I literally sit in my car and like write down my thoughts in my phone before I open up that door, because as soon as I open up that door, my thoughts leave my head, and some of my best thoughts happen when I'm driving. But yeah, if you look at a shoulder, because like a long time ago, I think it was Bill Hartman. If you guys aren't familiar with Bill Hartman, he's a PT who's almost too smart for his own good, very, very intelligent individual, kind of built his own model off of like PRI concepts. But he was saying how if you look at the structure of like a pelvis compared to a shoulder, the scapula is similar to like the iliac, and like you can kind of distill how both structures kind of like evolved away from each other to do different things, but like from similar structures at one point. And so if you look at like the hip, we kind of find stability through IR at the hip. We kind of find stability at the shoulder through ER. The biggest muscle that connects to the hip is our glute max, which is an external rotator, whereas the biggest muscle that attaches to the shoulders is an internal rotator, being the lat. Shoulders kind of meant to function openly with our environment, be very reactive, whereas the leg is supposed to produce a lot of force and be like our connection to the ground. So it's like functions kind of are in reverse, and you can see that it's kind of expressed through the way the structures are created from muscles and a bony standpoint. So like in a way they're kind of the same thing, but then flipped around because their like purposes are different. Like we're not meant to walk around on our hands. I've been trying to take that concept and figure out, all right, well, if someone can be fixed by finding IR at the hip, how can I then take those similar concepts and help someone fix their shoulder? I haven't found that answer yet.
Still a work in progress.
Yeah, shoulders are currently my least favorite thing to deal with.
No, that's pretty dope though. I like that thought process.
Thank you. I think it's funny because I think it's pretty much true. Like, especially if you look at it from like the muscular standpoint, like through the lat and the glute, like yeah, the two biggest muscles, and they do exact opposite things, and it's the opposite motion of what we're better at those respective joints.
I don't know if this is going to be an accurate question, but what was your head like when you were taking PT school questions? Because I feel like it's a way dumbed down version of everything you just said, and I feel like my head would just be in shambles.
I don't know if you guys would agree about this, but I feel like I was kind of quiet in PT school in terms of like discussion based stuff. And it was always because of like, personally, it was because of my thought process. And so I was like always trying to just like take the information the way I needed to take it in order to then pass. And that's why as soon as we got done with school, I was kind of like, oh my God, I'm free to like think the way I want to think and view things the way I want to view them. And in a way, that's been kind of like a detriment to how I am as a clinician at this point in my career, because it's like I need to be much more evidence-based as opposed to anecdotal. I feel like bell curve, I'm much more at the anecdotal end as opposed to the evidence-based end. So I need to work my way over to that end. But I think the way I thought throughout PT school just made me kind of question everything. And one of my tutorial leaders, I don't know if you guys have talked about tutorial at all on this podcast. If anyone listening knows what tutorial is.
I don't think we have.
We did on like the very first one. We were just talking about experiences through PT school.
Okay, so like our tutorial class,
right?
Small group of us break down a case. We have a leader who's a professor or a practicing PT that kind of guides it. We give individual critiques, et cetera, et cetera. One of my leaders told me that her favorite thing about me is that I never take anything with like a grain of salt or like at face value. And I was like, that was like one of the biggest compliments I'd ever received, because it was like, yeah, I don't like, I feel like everything should be questioned or else we're not going to progress anything. Like, it's the same thing with like these old practice, not necessarily guidelines, but let's just say like techniques that are implemented in like certain cases over and over again, like return to throwing for baseball pitchers and stuff like that. It's like, I didn't go to school for 3 years and spend a crap ton of money just to follow these guidelines that have been printed out. Like, I want to be a thinker. I want to like progress things. And I also want to be questioned myself. Like, the only way any field has ever progressed forward is with people questioning the ideas that are at hand already and building off of them. If we all kind of just sat there and were told how to think and practice, and everyone practiced the same exact way, it's like, this profession is not going to go anywhere. Like, you're not going to go anywhere. You're going to be the same minded individual for your career, and the field's going to stay stagnant too. And I think I've always just wanted to kind of think outside the box and find new answers to the questions that exist that already kind of have answers, but the answers could be better. Right. Because I think there's always room to make things better.
And it's tough. In a school setting, we had about 70 students, and everybody is just trying to remember what's being told instead of like, all right,
forget the thinking.
Yeah, forget about like the next, why are we saying this? Is like, first,
what are we saying?
It's like, yeah, I don't even know what you're talking about. Like, and so especially when getting to like the ankle mobility mechanics and how to rehab ankle sprain and this, that, I'm just like, first, the information that you're telling me is not going in. And then, and it's tough because we had, I think one of our classmates, Roy Coulter, you guys think similarly, but he will always ask those questions, why? And go in. And so everybody else is like, hey, look, we just want to know the basics. And everybody was like, and you could just tell like he was trying to work through it on a much deeper level. And it was like, hey, look, everybody around here.
He was just the one to ask.
Right.
And I would just sit there up in the back row, be like, I'm just gonna keep this to myself because no one wants to. It's
already hard enough.
And the stress and the emotions of everybody just trying to just get the basics down is like, we don't need to take it further.
I gotta say that, Dusty, I am truly grateful because the first my first clinical, I had sent you guys like it was some like random low back pain like protocol on how to treat someone with low back pain. Dustin just goes, I don't agree. I was like, what? I was like, what do you mean I don't agree? I was like, this is a research article and it had everything that you should probably start with. And he was like, I think a lot of things you could change off breathing. I was like, the fuck are you talking about? And then finally, it wasn't until probably like my second or third year that I was like, oh, I get a lot of what he's saying now. And so it was like even little things like that.
You know what's funny? If I went back and saw that conversation now, I'd probably disagree with myself and like everything else that was said too. As I rightfully should, because I'm like totally different individual now than I was then. Like we all know so much better. And at the time, I was probably I was a dumbass, and I still relatively am a dumbass compared to something. But I probably didn't know as much as what I was talking about then as I do now. But I know different things now, so I'd probably disagree with past me just as much as he was disagreeing with whatever the article said at the time too.
Yeah, and I think you're always challenge everything. And so even though this is like an evidence base, I was like, hey, this works. You're just like,
but what can be better?
Or like why does it work?
Right.
And I don't really know where that comes from either, to be quite honest with you. It's almost like I just have this weird spiteful chip on my shoulder that everything that's presented to me can be potentially wrong.
It's true,
so
though.
It's like, I think that's one of the issues I have with like myself and like posting any of my ideas. It's like, no kidding, you're kind of scared to like put yourself out there. I need to be better at that, especially in terms of like what I want to accomplish for myself. But I was thinking about it. This is another driving thought. I was like, every idea that anyone shares is going to have holes in it to some degree because no one's perfect. So an analogy I came up with is like everyone's idea is kind of like a pail, right? A pail of water. The fewer holes you have in that pail, a pail with less holes is gonna drain slower. So it's like, how fortified can you make your idea? How strong can you make your pail so it just doesn't leak as fast? And then after you do get the leaks exposed, it's like, what are you going to do to then fill those leaks?
Right. Yeah. Because every time you have these conversations, every time someone challenges what you're thinking, you're able to recognize where those holes are and then work on it. You think about it, you patch it up, and then you're able to go on to the next and keep filling it and then keep challenging it, because that's what really expose is like, do you really believe this? Or how can you take it another step deeper? How can you take it to the next level?
Like, is your thought process accurate? Are you just like missing something?
I think that's huge. Also, just even like teaching people who are new grads, because it's like you get these research articles in school and you get these textbook patients, and then you get your first patient. It's like, oh, I have 10 different things going on. It's like, if I don't understand the root of why I wanted to do that or how I can take it a step further, it was like, you're just going to plateau with that patient.
Yeah, I feel like in school, some of the answers that are presented to us was like, if if this is their pain, then if you just do this, they'll get better. And it's like, that's not true to the slightest in reality.
Exactly.
It really isn't. And I think it was truly presented to us in that sense too, where it was like, this could just be the simple solution. Maybe it could, but like the likelihood of it being that way every single time is so slim, because everyone's coming in with a different bag of stressors, a history of physical endeavors that are totally unique to that individual, and a research article is not going to be able to account for those things by any means.
Dustin, what do you believe that you can prevent injury?
I think you can minimize the risk of it, because I think as a field, we are kind of all agreeing to the point where it's like the term injury prevention is kind of bullshit. I think it sells the idea that like you're gonna actually absolutely bulletproof someone, and then if something does go wrong, it's kind of like, oh damn, like you failed me. An athlete, if we're talking about in just the essence of athletes, like they're the Ferraris, right? Like they're meant to go fast for like a performance, like they're a performance vehicle. They're meant to go fast. They're meant to get a little beat up, and then you need to repair them. And sometimes things do go incredibly wrong. And it's like, it's not necessarily the how they got there. Like everyone wants to kind of argue about how an ACL injury occurs. It's like, yeah, if we can find the root source of the problem, if from like a chronic standpoint, it'd be great. But at the same time, how you got there is one thing. It's more important now, how do you get back? You know what I mean? Like the path forward is the only thing you can control, so why not focus on that? I think it's very hard to account for how much you can prevent an injury because you have no, it's just something that's kind of from a physical therapy standpoint, it's kind of out of our control and like out of our, like we don't have necessarily anything that can predict it. Like I'm sure there's some KPIs out there that you can track, but like the amount of work that's put in to track those things is very high, and you may not be able to do that for like a high school athlete. It may be more applicable to just like pros, and that is one option, but that data can always fail you too because of some sort of external factor. You know what I mean?
Right. There's so many variables you literally can't control everything or know everything just based on history and like family history and all how their anatomy is. Like you just don't know what someone is susceptible to.
I think also, right, like you said, the external thing. One of the things that I kind of saw was even something as simple as like someone's girlfriend breaking up with them right before a big game is like, I can't control that at all. But it's like that might have affected your sleep or your mood or your focus. So now when you're going into this game, it was like we might have done everything I could think of to mitigate the risk of you not tearing your ACL. But that minor thing I had no control over. So it was like, I don't think there's ever a way that you can 100% reduce or 100% like get rid of injuries. Even still, you think of football is like you get a 300-pound lineman landing on your knee is like I'm done for that. There's like I can't control that.
Yep, nothing's perfect.
And taking that a next step, I know we've had this conversation about does posture play a role in back pain per se? This is like a specific conversation we had. And you were on the response that your posture doesn't matter or is not the driving factor that you have back pain. Like you don't have back pain because you have bad posture. Are you still kind of thinking along those same lines, or like how do you think about that now?
I kind of am. I think it's only something we need to criminalize if we immediately adjust posture and pain changes. Because I think our resting posture is just like our way how we navigate against gravity all day and complete our task at hand. One great example I heard a long time ago was like if you look at some MMA fighters, like specifically, I think it was Nick or Nate Diaz. Both of them are so like rounded at the shoulders, kyphotic at the T-spine, and it looks like crap. Like their posture like from an objective standpoint looks like crap, but it's because they need to be here to protect themselves. It's a byproduct of what they do on a daily basis, and it's like the body adapts to the demands placed on it. So it's like, yeah, if you sit at a desk all day and like you do get that forward head, rounded shoulder look, it may not necessarily mean that's what's causing your pain. It just may mean we've hit a capacity for you being in that position for so long that you need to build up a little bit of strength around that structure to support that position. It might not necessarily mean that position is bad. It just may mean you don't have the prerequisites to sustain that position anymore. It's kind of like, that's how I see it. I tell a lot of patients now that like I don't like to criminalize posture. I have some that like try to force good posture too much, and that's almost more provocative for them than anything else. It's like, yeah, you just need to relax.
I think another thing that I usually ask people is it's okay if you're like that, but why are you like that? Those like if you can't get out of it, that's a different thing. There's the same thing with like that tilting. Is like it's all right that you have that anterior tilt, but can you get out of it? And if you can't, then that's probably something that I would say or
Yeah,
work
like
on
is this
something
the
like
only place on our map that we can navigate, or
that.
can we
Mhm.
go elsewhere? Like, are we stuck to just sticking to one block, or can we go the other side of town?
Yeah.
Yeah, I don't like to criminalize any actions because that's like similar to dieting. Tell someone they go on a diet, now they only focus on one thing, and it just causes this like emotional stress. That all right, if
Yeah,
I'm not straight up and arms
Yeah.
back, like I'm gonna be in
Yeah.
pain. So they're just constant. It gives them something to ruminate on, and it's like
yep.
that's not the idea. The
Mhm.
idea is just to be stronger and have your and so your body be able to sustain a certain position, not to always be in one position versus another. You need to be fluid.
Yeah, it creates that fear avoidance too. Like, which one thing I've noticed heavily, like the one big issue I have with like Instagram is like the individuals who don't necessarily have the background to speak on certain things, and they like kind of like victimize certain positionings and exercises to be related to like injury. Like the famous examples are like knee cave in a squat and then elbow flare at the like on a bench press. Back to the whole shoulder and hip thing. It's the exact same kind of compensation. It's just the body's ability to produce force. Like your elbows are gonna flare because that's your body's way of saying I can do that here. I can't necessarily do it here. So let me go there and produce force. Neither one is inherently bad. There's like literally no evidence supporting either one is going to increase your risk of injury. But people love to just go and post about it because they need to get clicks and likes. And it creates this giant cloud of fear avoidance over these certain motions. And now those are just two examples, but you can really tie it back to just like a patient who came in, like they're told that they can't like squat or ride their like bike at home anymore, or do like these little things that mean so much to them because they think that it's just going to damage them, and it messes with their mental so much. And those restrictions I think are just like very very detrimental to the healing process as a whole, because it makes them feel like they're boxed in and they're like these fragile human beings that can't stray away from this path. And then once you give them that like confidence and freedom to get off that path, it's just like exponential gains from that point.
I have a question for you, both of you, actually. I was talking to Jair the other day. He was like, I think as PTs, we don't do a good, I don't remember exactly the conversation. He was like, I think we don't do as good of a job as diagnosing. I was like, what do I diagnose for? It was like, for me, if I diagnose, all I'm doing is just putting a label on what you can't do. It was like, for me personally, I think I have no idea what's going on most of the time. But I was like, I know you can't do this, this, and this in terms of movement or movement coordination. So it's like, why do I need to slap a label on it and tell you? So that way you go and look up all these things and get that fear avoidance type of thing. So like, do you diagnose, or do when a patient comes to you for an eval is like, hey, I have back pain. Like, how do you kind of go about that? Do you just go and say what you can't do, or?
I think
Uh,
I do it very similar to the way you do it, Tyler. It's kind of like I paint a picture of like this is kind of where your limitations lie. If we fill in these boxes and see how you progress from there, then it should be the solution. I think you also have in the same instance like cases where patients do just want answers. They want to know like can it be this structure, can it be this or that. And sometimes like if those questions arise, then like I'll answer them because that's kind of just what they need. But it won't be my default to label it as like a diagnosis of this or that. Um, it's kind of like if they are seeking those certain answers, then I'll provide them. But I don't want to like overfeed a horse, if that makes any sense.
yeah. Um, I think there's a couple of different ways I like to think about it. But initially, when we're thinking about, for example, low back pain, and the current concepts, I believe the current concept program is for the study guide for the OCS. And the program, it says we don't and specifically looking at low back pain, it doesn't help to identify a certain structure. There's so many structures, and the likelihood of you getting it right of what particular structure is causing a pain is not very likely. So look at movement functions and how you can change the function to decrease pain or improve mobility or insert goal. And so it's like not necessarily looking for a specific diagnosis, but to Dusty's point, like you have to give them some answers, and because they're looking for that, like they're in this place of vulnerability and uncertainty. It was like, and ultimately they just want to know, why is this happening, or what's the prognosis, like what can I expect? And so you want to be able to comfort them. I was like, all right, this is what we're looking at, this is what I see is going on, and I believe if we fix these deficits, we can have get you closer to your goal.
Okay, gotcha.
Yeah, because like big deal if we identify the structure. Like we don't have scalpels, we can't go in and like influence the structure to that standpoint. It's like we need to outfunction whatever the structure is as PTs. So it's like, yeah, the structure may not necessarily always matter.
Right.
That's the way in which I think. And usually, so I've been kind of changing the way I've been treating. So it's like my evals don't necessarily go. So I do my lower quarter screen, upper quarter screen, just to kind of rule out this stuff. But I'll be like, all right, do this movement. If you can't do this movement, all right, that's the first thing I'm already going to tell you is your homework. So it's like, I don't care if you have a shoulder problem, if you can't do a pelvic tilt or you can't even single leg balance and you're trying to be a pitcher. It was like, for me, I don't really necessarily look at the shoulder right away. And I'm more likely to look at something like that and then branch up to the shoulder or something like that. So I was like, I can see where your movement faults are right now. And I really can't tell you much about your shoulder, but I can tell you probably that's not the cause and more so the victim.
Right. And
right, like
bringing in,
I was to say, do you have the
let me just, I have this specific patient in mind. I just had an eval last week, and she was like, she had low back pain, and she loves to ride her bicycle, but she can't do that just because it causes pain, and she can't ride in her car. And everything what she was telling me, because her being a hip flex position hurts, and just being able to, I passively took her into hip flexion, and she reproduced her pain. And I was like, all right, this is what we need to fix, like just hip mobility in order for you to get back to what you like to do. Because she just wants to get back on her bike, and like that's her favorite recreational hobby. So I was like, all right, let's do it. And so even after the first session, and just by producing improved hip flexion, she came back. She was like, feel like 70% better. Like I was able to make a road trip to Los Angeles and back, and I had minimal pain, and I thought I was going to have to cancel the trip.
Oh shit.
And so she was just like, I was surprised. I got off the car and I was like, I actually feel fine. And it was honestly just like improving hip flexion. And I was like, I don't need to be able to go in and figure out what spot in your back is hurting. It's more about, all right, well, how are you moving and what just reproduces that pain?
Gotcha.
What's what I'm thinking.
Yeah, it's like finding that window that you can work within. That's the capacity that patient can like perform pain-free. And the more you work within that window is going to widen over time and just give them more freedom to do different things.
Gotcha. I kind of want to pivot to your training program, if you can touch a little bit upon that and how you kind of got started with that.
So I created Entropic training systems in the 2020, kind of a few months after quarantine began. That was me wanting to put a label to my remote coaching and kind of make it its own true community. I started kind of the remote coaching thing my senior year of undergrad, where I was just doing it for friends, kind of testing the waters of it. And I realized I really enjoyed it, and it allowed me to like kind of have like that reach as a coach. Granted, it probably wasn't the easiest idea to start it from a remote standpoint, having not ever done it in person with anybody. But I think being developing that from a remote standpoint and being able to teach someone to feel movements from afar over text messaging made it so much easier in person as a PT. But that was something I started my senior year of undergrad and has grown ever since. And now Entropic's kind of like my baby, if you will. We have 3 other coaches under the same name. We have Mike, Dave, and Evangeline. Um, they all have their own specialties and things that they're really good at, and they're all people that I trust highly with how they carry themselves as coaches, what they kind of embody, and the fact that they want to help grow this thing with me is kind of why I brought all of them on. Right now, we work with basically any sort of population, but at the same time, a remote coach is a very niche thing and it doesn't work for everybody. I think some people that I've worked with have also realized that it may not work for them best. One girl that I coached for a little bit realized, hey, I may need someone in person for a time being because it's like, I think I'm gonna get more from that than this. And it's like, yes, then go do that. Like, you need to do what's best for you, hands down. She got the things that she needed from in person, and she's actually back working with me now, and she's a totally different individual because she had that feedback in person. So having a remote coach is definitely not for everybody, and it definitely takes some degree of like like your own discipline and adherence because that person's not there with you. But at the same time, that's also kind of on the coach's job to make it feel like I am there for you and with you on this journey at the same time. Because if I'm just texting you every day, you may not necessarily feel like I am as invested into it as you. So getting individuals to feel that investment from your end has been huge for me in terms of like my coaching. And I think a lot of my clients would agree that they see that I really, really do give a damn about what I do for each and every one of them. And I love it. It's kind of exhausting. I say that it's harder than my actual job as a PT just because it's like managing all these individuals and not having them ever in person. So it's like, it's totally up to the communication standpoint. No, but I love it. And we work with we have patients coming back from like pain, lifestyle change, body composition change. We have power lifters that compete. We have people who just like to train as if they're power lifters. We have individuals searching for just like strength gains, hypertrophy gains, really just looking to better themselves and make sustained long-term changes. And that's kind of the goal across the board for us. It's like, we don't want you to be dependent on our coaching forever. We want to give you the tools you need in order to then like teach yourself and then eventually not need us. What we want you to do though is stay with us because you enjoy being with us. But if we're not giving you the tools you need over the course of, let's say, 8 to 12 weeks to learn something and possibly be at the point where you can be self-sufficient, then we're not doing our job as coaches. And I think in this field, there's also a lot of individuals who don't do that. And they develop intentionally that dependency of the coach and client relationship where it's like, this client is not going to be anything without the coach because they haven't learned anything. The only way that they're going to succeed is if they have that coach. And that's when it becomes more of like a money thing as opposed to an individual success thing for the client.
Do you have like a mindset, like, I guess like an introduction? Because I feel like that's a big thing that I struggle with now is a lot of people want to have someone that tells them what to do in terms of like my patients. A lot of them, I feel like, hey, like I feel comfortable coming to you because you know what you're doing. But it's like my job is to empower you. And I feel like there's a disconnect in the physical therapy field between patients and the PT or the doctor or whatever it may be, that it's like they feel they'll get better under the guide of a PT or doctor. Whereas I want you to have that autonomy to do it on your own or to want to do it on your own. So do you have like mindset, like crash course before you start my training program?
I think a large part of that just comes from the consultation, like figuring out, is this individual going to be a good fit? I also believe that if you are seeking out a remote coach, then like you've probably already gone through the thought process of what it entails and making that commitment, people are going to reach really for like the fruit that they wish to harvest. Like if someone's reaching out to a remote coach, it's more than likely that they actually want that and may need that. As like you're not going to go to the gas station if you don't need gas, right? Like you're looking for what you might necessarily want. It then becomes to the point where like, is that individual going to work well with me as a coach personally? Because everyone has the different styles, everyone has different ways of going about things, communicating, etc. Some of my clients require a lot more communication than others. It's all different and individualized. But it really is like kind of like from a character standpoint, like style standpoint, is this person going to fit and is it going to be beneficial to them? And it's important to be honest and be like, hey, I don't think we will work and I don't want to waste your time. I don't think I've really had that instance happen yet, but it's definitely something that's a possibility.
So in the sense that you haven't met anyone that wasn't a fit?
Yeah, I personally haven't. I mean, I guess the one instance would be like the person who needed like some in-person stuff first, but that's kind of something that's hard to screen for. It's more like you trial it, you see how they respond to the remote standpoint, and then you make that decision as things don't necessarily start to work. And that's just evaluate, like self-reflecting, like, is this working or is it not? Are you and the athlete communicating well with each other enough to the point where like you're making change? Or are they not communicating with you at all and not giving you an opportunity to create any change or get any better? Because if you're not aware of the problem, then how can you fix the problem? You know what I mean?
Right. And then my question is, it's like, do you have any scheduled kind of reflections that you have with your clients from a training standpoint?
I do like a weekly check-in form, but I'll give them the option of like, do you want to have an actual like FaceTime check-in, etc. Because some people maybe cruise in a really good wave of training where it's like, yeah, shit's going well. Like I don't necessarily need to like sit down and have a conversation, but it's also up to me to kind of like through conversation detect like maybe we do need to sit down and chat. I don't ever want to be like exhaustive with having like those routine like sit down check-ins because that can be a lot and not everyone's schedule is like caters to that by any means. So it's kind of like a go by feel basis with that and like matching the individual's needs. Like, do they need the conversation or do they not need it?
Cool. I think one of my questions is it's interesting. I feel like Jair also talked about this too, is a lot of PTs don't feel comfortable with exercise or like progressing exercise or programming exercises. Do you have a way that you kind of follow of like how you would like to program? I know it probably depends per patient.
I definitely have my style and my biases towards certain movements in order to create certain results. Would I be able to like objectively describe that? I'm not sure. I think, I guess if I had to start from it, like from a foundational standpoint, it's like start at spine, go to rib cage, go to extremity. Do you have the prerequisites at each kind of standpoint or each layer to then achieve what you need to achieve? I try to have like my gatekeeper exercises or like assessments at each one of those levels to be like, all right, you're good here. Now let's go to the next stage. Go to the next stage. Like you kind of have to earn the right to be in these positions because if you don't have that earned right, then you have no reason to be there. It's kind of like with a hip airplane. Like if you can't show that dynamic stability on one leg, then why do you think you have the right to put the other leg on the ground, load a barbell up on your back, and squat with two legs if you can't stand on one?
Yeah, 100% I agree with that. And I think that's interesting when you get into like the CrossFit field or even personal training. Is like, how many people have you screened to be in that position before you loaded them in a ballistic movement?
Yep. It's like, do you have like a right to be there. It really is a right to be in certain positions under a load. And a lot of people don't have it or don't necessarily have anyone around them that knows how to screen for that and pick up on it.
Yeah, it's interesting because it's like, especially when you're thinking about high school sports or any type of sports, it's you don't want to create such a barrier that like, oh, I have to get my form right before I squat. But also you want to put someone be in a successful movement. Like you don't want to train a movement that's not optimal. I guess I should say, but I feel like it's a tough line. I was like, all right, you don't want to have to screen everyone based on just like, all right, that just creates stress and like a barrier to entry.
I think that's important too, what you just said. And kind of what you remember we had Kundi on, he was like, everybody on our, when we were doing, when we were at volleyball for college, when we did lifting, everybody did the same exact lift, no matter what it was. And although you maybe don't have to screen every single thing, I think you're kind of doing athletes a disservice or whatever it is by not doing it, even if it creates more stress. Is it more stress for you in the beginning, or is it going to be more stress for you when you have to rehab them because now they're doing a movement they can't physiologically do? So it was like maybe they just don't have the certain extension that they need in the spine to do a back squat. So it's like, so am I going to load 250 pounds on the bar and make them do that and tell them they can't play now if they can't hit these numbers? So it's like, it is stressful, but I think if we're really focusing on making someone as optimal as they can be, it's kind of necessary.
Yeah, and then through the screening process, like, is the results of the screen necessarily something that you need to change, or is it not? Like, some people are going to accomplish, like, if you get two individuals perform the same exact task and have it look completely different and have that be completely okay at the same time, because everyone's specific to themselves, individualized. I've had some individuals who it's like, yeah, the way you're performing that kickstand RDL isn't the way most people look like when they're performing it, but you're feeling what I want you to feel. So I almost don't care that it doesn't look the way that the picture should look, because you're accomplishing what I want you to accomplish, but you're doing it in your own way, because this person has their biases towards moving a certain way, and it's like, this is the shape they're taking. We're on the right path. It doesn't necessarily have to look like, if you had a row of 10 people performing the same exercise, they don't have to look the same, but do you have that indicator for yourself that tells you each one of them is actually performing it the way you want them to, like whether it be sensation or output, like objective output, so be it. You need to have that kind of that measuring stick to determine whether or not it's effective or not.
Yeah, I think that always goes back to that question, why? It was like, it may not look the same, and that's totally fine, but why does it not look the same? Is it something that you're lacking that we can fix with exercise, or is it something that your anatomy just doesn't allow you to do? Then you get back to that question. So do you feel or do you sense what I want you to sense, and do you get the same thing out of the exercise? It was like, that's pretty, I feel like it always comes back to that why.
Definitely. And then just like, doesn't matter, because like you can have one example I like looking at is like in deadlifting, just the degree of like thoracic flexion. Like, some people literally get into so much more extension in a deadlift and they love it and they thrive off it because they fall at that end of the bell curve. Whereas like myself and a lot of high level deadlifters do have a relatively flexed T spine, and it's because it's like it's mechanically advantaged towards these individuals. Like, it's just what works best for them. It's the path that their body likes to take in order to accomplish it, and sometimes it may not ever be problematic.
I think I have one question for you, and you kind of touched on that. What is your take on picking up heavy objects if you're just a regular worker and you're picking up boxes? Then everyone tells you make sure that you squat with your hips, whereas you see these deadlifters that are picking up 600 pounds with more trunk flexion.
So this was another driving thought that I had the other week. The same generation that told us that we need to pick things up from the floor with our bending our knees are also the same generation that told us their knees going over our toes are bad for us. Like what a fucking like that's honestly like I put that together. I was like, yeah, the same people who said that like your knees can't go over your toes also told us we have to pick things up from the floor by bending our knees.
Yeah. It's like you
As
ever
a-
walk
Like,
down the
huh.
stairs? Walking down the
Yeah.
stairs is knees over toes.
Yeah, like it's I don't know. I think it goes back to the whole fear avoidance and making people scared of movement. Like, I don't know. I blame that generation.
Hey, look, y'all messed it up. We were just trying to fix it.
Yeah, movement, the housing market.
I was like, y'all just left us in a bad spot all the way around.
And then told us it's our
Yeah.
fault. Told us we're the
Yeah.
ones doing shit. And it's like none of us are in power.
Yeah, wild. Can't
But
buy houses and we can't squat.
thank you, Dustin, for coming on. I really appreciate it.
Yeah, we might have to do an episode 2. Shit.
Definitely have to get you back on.
Let me get smarter before I ask those questions, though.
Let me get smarter. Remember, we're all dumbasses relatively.
There we go. There we go. We can
No,
all
thanks
learn.
for having me, guys. Maybe the next time we do it, it'll maybe be in person.
Oh, shoot. Dusty,
Mm.
give the fans or the audience your Instagram handle if they can follow you.
Where can we reach you at?
Instagram is at doc_Willie_, and then in my bio is also the link to Entropic's page. We try to post at least once a week, but we're really bad at it. And a lot of the stuff I post is just through my stories. So yeah, if you want to give me a follow, feel free.
He posts some good workout movements. I feel like little snippets that at least are pretty helpful for me.
Especially,
yeah,
I like
I need to be better at
watching
that.
the pre-workout kind of movements and things that you do. I always think are pretty interesting.
Thank you. Appreciate that.
Of course. All right, Dusty. Appreciate it.
All right, now.